I'll just briefly explain it, if that's all right with you.
Yeah, sure.
One who suggested it. Provincetown has a very good network of mental health and substance abuse providers. So Provincetown has a great network of substance abuse and mental health providers. The challenge is that it's bifurcated, that we have we have AIDS Support Group, Howe, Gosnold, Outer Cape, all of these things. Great example is, I need to get to the doctor in Hyannis or in Boston. There are 4 ways to get a free ride. Which one applies to you and which one applies to you? How do you navigate that? And how do you navigate that with diminished capacity? We need someone who is able to sort through that and to help people and advocate on behalf of people. They're not providing direct care. It's not related to actually providing substance abuse treatment or mental health treatment, but instead helping people get access to it. Something the town nurse used to do years and years ago, or at least part of what the town nurse was supposed to do. And it's something the town really needs to do, because we have so many people here who have these problems and who aren't able to access care because it's just too complicated. That's why Article 7 is being presented to you, and what we hope it solves a problem that's a pretty desperate need in town.
Clarifying questions? And if Morgan does come, we'll give her some time as well.
I don't have a question, but I just agree that it's a safety net that's being talked about here that would be of great value to this town.
I do have a question. Is this someone who would be like an MSW or CSW? What type of, has any determination been made about the person who would apply for this position?
So it's maybe a person, or it may be a collection of people, or it may be a bit of people in organizations, because I suspect there's a group who are going to deal with specifically sort of meth addiction kind of issues, and some opiates, and some mental health. And those may be, one person can handle all of that, and maybe response to the RFP will be that one person who does all of it, or it may be a collection of nonprofits and people that get to an FTE.
Wouldn't, just to clarify that, wouldn't that sort of replicate the current problem of having 4 or 5 different groups doing different things? You have 3 or 4 different people doing this.
So the way, what I was envisioning was that we'd put out an RFP that would have, here are the type of issues. What are your qualifications? The standards on the qualifications, and also looking to hire the best qualifications. And then I think it would be 1 or more. You could apply as a team, or you could apply as an individual. But I think that we would want to push towards team application or team approach, because I think you would want, the whole purpose here is a coordinating. And so you'd sort of come in that way, and maybe there's a couple specialties down below, but you need that one person at the center of the web.
Is that clear?
Is
Yeah.
Okay, thank you, Jane.
Is this a 1-year grant, and what would happen in future years?
So this is a half-a-year grant, and if it passes, I suspect I'll push to put it in the operating budget for next year.
So in the operating budget for next year, it would be 100,000, because then it would be for a 4-year.
And that's effectively an FTE, fully loaded with both salary and benefits.
Another question. Who would supervise this person?
We place it under health.
So somebody in the health department?
Yeah, right now, that's why also, as was stated earlier, seeing whether Morgan was able to be here this evening, probably under Morgan.
Mm-hmm.
Eventually the buck stops here.
Okay.